Hello. Yes. Are you here for your cranial nerve exam? Yes? Okay. So, you had a fall and you injure your head. Okay. Are there any symptoms you're worried about or your doctor is worried about? Yeah? Okay. So, in order to see if there is anything going on with the nerves that come out of the base of your brain, we neurologists perform a so-called cranial nerve exam. It is to see if there is any malfunctioning of any of these 12 pairs of nerves that come out of the base of your skull, and they sort of move your eyes, help you swallow, make you smell things or see things. Okay, I'll explain this a bit better in a minute. I see I have this chart, and this is the base of your brain. I don't know if you can see this, but here where the base of the brain is, it's like looking from your feet up. There are those cranial nerves. They start here in the brain, and then they connect your eyes, your ears, your throat, your nose, your face, even the accessory muscles of your neck. So this way your brain is connected to your body, and they come out from different parts of the brain. As you can see here, some of these nerves come out of here, some here at the back, and they're symmetrical. There is the left one and the right one. That's why when we test your cranial nerves, we are looking to see if your eyes react in the same way, if your ears react in the same way. Yes, even if we look in your throat, we are looking to see if there is any difference between left and right, if things work normally, or if there are any abnormalities. Okay? Alright. So, because you had this fall, there might be some abnormalities within, the base of your brain. Something might have been affected. So we need to check all the 12 pairs of these cranial nerves. Are you ready? Okay, then let's start. Okay, I have a few questions for you, just to rule out and help me diagnose what's happened during that fall. Do you have any blurred or double vision? Any facial numbness in your face? Numbness or tingling? Any weakness you can feel? Do you have any difficulty swallowing? Do you cough while you try and swallow? Okay. At any time, do you have any dizziness? Do you have any tinnitus, which is ringing in the ears? Have you noticed any hearing problems? Is your hearing still normal, or are you a little bit hard of hearing? So, as the first test, we're going to test your olfactory nerve. This is the nerve that comes out of the brain and goes into your nostrils, and thanks to that you can smell. Okay? I have 3 essential oils for you. And I will ask you what you can smell. Okay? We'll test each nostril separately. So, if you could close your eyes and put your finger on your right nostril, and I will let you smell this essential oil with your left nostril. There you go. Can you smell what it is? Okay, that's correct. Yeah, that's clove. Perfect. Okay, if you could put your finger on your left nostril now, we'll test your right one. Okay. This must not be very pleasant for you, but can you recognize this oil? No? Okay. You can open your eyes. Okay, that was oregano. Let's do one more test with something more familiar to you. Okay, close your eyes. Put your finger on your left nostril. We're going to test your right nostril again. Okay, there you go. Can you smell what it is? Okay, yes, that's cinnamon. Okay. Let me just type a note about that. Thank you. Okay. Where's my pen? Okay, next we're going to test your vision. So we're going to test your optic nerve, which is the second cranial nerve. Okay? Are you ready? We're going to use this chart, which is called Snellen chart. So if you could move a little backwards. Okay. It's supposed to be tested from 6 meters. Okay. Tell me what you see. Which letter this is? Correct. But that was easy. Okay. Let's try this one. Yeah? Yeah. Okay. Let's make it a bit harder. Let's go down to the green line. Can you see? Correct. This one? Correct. This one? Perfect. Yep. Perfect. Can you see the letters on the red line? You can't. That's perfect. That's perfectly normal. Yeah, they're very small. But I am satisfied that you passed this test. Okay. Yes. Let's do another test. I'm going to shine some light in your eye and look into the bottom of your eye, if you may. Okay? Alright. Thank you. Okay. We're going to do what's called fundoscopy. I'm going to have a look at your optic disc. So this is where the optic nerve is in the eye, and thanks to that you can actually see. Okay, I'm just going to have a look at that. Okay, keep your eyes open. I'm just going to have a look. Now your other eye, please. I'll come a little closer. Okay, the other eye, please. Yes, thank you. We're going to check your peripheral vision now. Okay. If you follow my fingers and tell me when you stop seeing them. Okay. About now. Okay. About now. Yeah. Okay. Perfect. Now we're going to check your color vision, whether you can recognize the numbers in this book. This is called Ishihara book. Okay. Have you ever had any problems recognizing colors? No? Okay, let's check. What number do you see? Yes, correct. What about here? Okay. And here? Perfect. Okay. Let's make it a little bit more difficult. What about this one? And this? Okay. What about here? Do you see any number at all here? This is a tricky question. Yes, because if you have a normal vision, you shouldn't be able to see anything. I'm sorry for that. Just lines, yes. What about this one? Yeah, this one is a bit more bright than that, but it is double figure number. What about this one? Perfect, you passed. Yes. Okay, we're going to check your eye movement next. Okay. I will have to shine some light again in your eyes to see how your pupils are moving. Okay. Alright. Okay. I'm just going to check your face, whether there is any weakness on any side. Yeah. It looks okay. Let me just check your pupils. Okay, just look directly on my face, between my eyes. I'm just going to shine some light in your eyes. Okay. Yeah. I'm just checking whether your pupils are equal and reacting to light equally. Yeah, everything seems perfectly normal. Okay. Perfect, lovely. Pupils equal and reactive to light. So in this way, we've checked your third, fourth and sixth cranial nerve. These three are responsible for your eye movement. Next, we're going to check your trigeminal nerve, which is the fifth cranial nerve. It has 3 branches and it's responsible for your motor function, reflexes and sensory function of your face. Okay, so I'm going to touch your face. I'm going to touch your forehead, your cheek and your jaw, and I'm going to touch it lightly with a brush, and then I'm going to touch it with a sharp object, and I will ask you, what do you feel? Okay, perfect. Okay, close your eyes please. Okay, tell me whether you feel a soft touch or a sharp touch. What about on the other side? What about now? Okay. And this one? Okay, so you passed the sensory test. Now let's check the motor function of your trigeminal nerve. Could you clench your teeth? I'm just going to palpate your muscles on your jaw. Yeah. Okay. Perfect. So, I'm just going to check your jaw movement. So, if you try to move your jaw against my hands, against resistance. Okay. Alright, perfect. Okay. I'm just going to check your reflexes now. So, I'm just going to touch the corner of your eye with the brush. I'm not going to put it in your eye, just on the side, to see if you blink. Perfect. Oh yes. Thank you. So your trigeminal nerve seems to be working fine. Okay. Now let's check your nerve number 7, which is responsible for your eyebrows, your eyes, your teeth, your cheeks. Okay, it is a facial nerve. Okay, could you please raise your eyebrows? Perfect, perfectly symmetrical. Can you frown? Okay. Okay. Now I'm going to prevent you from closing your eyes, and you try and close your eyes against my resistance. Perfect. Show me your teeth. Puff out your cheeks. Perfect. Yes. Okay, number 7, pass. Okay, now the big one, number 8. We're going to test your hearing and balance. Alright, mostly hearing. Yeah. I'm going to whisper some numbers, and you tell me what number dangerous these are. Okay. Are you ready? Close your eyes. Yeah. 24. Perfect. 56. 14. Yes. 84. 105. Yes. One more. 75. Yes. Okay. You passed. And now I'm going to perform a rinse test. I'm going to use a tool called tuning fork, and I'm going to check whether you can hear better when I put this fork against your mastoid bone, or whether you hear it better if I put it just a little bit away from your ear. Okay. So you should be... No, I'm not going to suggest any answers, okay? I'm going to test it first, and then I'll tell you what it means. Okay. Alright, let's do your left ear first. And now this one. Okay, and now we do it in the air next to your ear. Which one was louder? This one. Okay. Now the other side. Let's do it again. Okay. I think you passed. Okay, now we're going to test your swallowing. Could you please say ah? Open your mouth. Could you open your mouth, please? I'm just going to check your gag reflex. No, it's going to be very short. There you go. Yes, all present and correct. Lovely. So that's number 9 and 10. Okay, number 11. Okay. Could you shrug your shoulders when I'm holding your muscles down? Okay. Once again. Perfect. Yes. Turn your head side to side. Okay, that's all okay. Okay, so number 12. Could you just stick your tongue out again, please? I'm just observing your uvula, the thing that's hanging at the back of your throat. Okay, let me just check. Stick your tongue out. Okay. No involuntary movements. All symmetrical. Yeah. Okay, close your mouth now. So, this way, we have finished our assessment. I will type the report now and I will forward it to your doctor. Okay, I will have to analyze my results. Okay, your doctor will let you know. Lovely. Okay, take care. I'll see you again soon. Bye bye.